Let's discuss mental health and HIV. You may have heard before that mental health exists on a continuum. There is a broad spectrum of mental health and mental illness. Individuals may experience short-term or temporary states of psychological distress in response to a stressful life event. However, this experience is not synonymous with a mental illness. Here is a graphical representation of what mental health on a continuum can look like. On the bright green end, an individual's optimal mental health, wellness, and functioning is captured. You may recall that the American Psychological Association describes this as a state of mind characterized by emotional well-being, good behavioral adjustment, relative freedom from anxiety and disabling symptoms, and the capacity to establish constructive relationships and cope with the ordinary demands and stresses of life. As we move into the darker olive green, we may notice that the individual continues to do well and is able to cope and perform within their daily lives. Both categories, the bright and olive greens, are able to manage their life's stressors with social support and self-care activities. As we move further left into the yellow category, individuals may be described as surviving and just getting by in their ability to cope. Social support and self-care activities may not be sufficient to help the individual successfully navigate the challenges they face. The category that is colored orange is indicative of an individual who is struggling and having difficulty coping. Finally, the red category reflects an individual's experience of severe mental illness and crisis. Both the orange and red categories require professional support to navigate the challenges. Throughout an individual's lifetime, they may move along this continuum, as mental health and wellness is not stagnant and will fluctuate. It will also be influenced by the circumstances being experienced by the individual. This is a simple representation of an HIV care continuum. It shows the steps that people with HIV take from the point of diagnosis on the left to achieving viral load suppression on the extreme right. Research focused on the PLHIV population revealed that this demographic is particularly vulnerable to developing symptoms of mental illnesses, which may negatively impact health-seeking behaviors inclusive of adherence to treatment. The most common mental illnesses within this population are depression and anxiety. PLHIVs are also at an increased risk for suicide and self-harming behaviors. The HIV factors that have been identified as contributors to the development and onset of mental illness include the chronic nature of HIV, anticipated stigma and discrimination, and the side effects of some ARVs. HIV and related infections, if left untreated, can affect the brain and the nervous system. This may change how an individual thinks and behaves. In addition to the stages highlighted in the HIV care continuum, other instances within HIV care where an individual may experience increased psychological distress include commencing ARVs, experiencing the onset of acute illness, experiencing opportunistic infections, and a lack of viral suppression. It's important to remember that as an individual progresses through the HIV care continuum, their mental health may likewise shift along the mental health continuum.